called a skinny BBL. It's what we're looking at a lot of times is that we're having to go to multiple areas. Like with a lot of BBLs, we might just do like what's called a lipo 360, where we're doing like the abdomen, flanks, and the upper back, just taking from those areas and doing the fat transfer to the buttocks. But when it comes to the skinny BBL, I start to look at everything I can to see what we can get, what kind of fat layer you have, and see what we can do. What we're really a lot of times is trying to remove from other areas once again, in order to make the buttocks look bigger. And then the enhancement you get is that we have a little bit more rounder or fuller buttocks just because of the fact we're putting more there. So first put your arms out here. So we start to look at arms to see if we can get anything here. So there is some fat here that we can probably take from the arms. So your arms look a little bit skinny, which always helps now. Your abdomen itself, there is some bit of fat layer where we have something here. Same things on the flanks right here. So when we take a lot from back here, some from here, what we're doing, we're starting to shrink all this down to make your buttocks look bigger at the same time. Now, on your legs themselves, we have some on the inner thighs here, and actually on the front of the thighs. I'm kind of cautious when we do the front of the thighs because the fat layers, you can go ahead and turn around, are very kind of skittish when it comes to wanting to take the fat out, because I've seen patients that have had aggressive liposuction there, and they have these the liposuction cannula, these streaks all going up and down. So we have to leave a fat layer there. So we always leave fat on there, outer layer there. We'll try and take only the inner layer. So what we could do, like I said, if we did this, we would take from these areas to try and shrink this down. And it looks like more we have kind of this hip dip area right here to kind of get a little bit more rounder. So that's what we do is like we probably go for your arm, do like the lambo 360 with your arms. I would probably also add the inner thighs and then your front of your thighs, and try and get as much as we can, and then put what we can.
Would that leave a scar or anything?
Well, you got a nice large tattoo there that I'll hide it. So you won't be able to see. On your other side, generally where the scar is going to be somewhere up high to where you won't see it. That's my goal, is to make it somewhere where it's generally not very visible. When it comes to like the abdomen, on upper back, so you have a tattoo on here, also somewhat high down higher, and then it's usually just like one and one here and one there.
So. It is so gross.
So that you have to understand is a lot of skin too. That's kind of a loosens from having your child. It kind of loosens the skin. You're a person that would say at some point in time might think about like a tummy tuck to really kind of include it. But I would probably, what I do first is always just do the liposuction.